Let's bring on Sandhya. Again, as David said, it's been an absolute pleasure writing this with Sandhya. We're going to bring her on here to speak a little bit about the Mayo experience. I can hear you, Sandhya. We just can't see you. Oh, right. I think there you are.
Right.
Perfect.
Here I am.
Okay.
Thank you.
Wonderful.
Great. Thanks again, Terry and David and Harry, for this wonderful collaboration that we've had in the past, oh my gosh, 6 months trying to get this book to where it is, and what an exciting experience. And thank you to all of you on the call for making this such a successful book. And the people I've shared the book with, I've heard nothing but wonderful things about the quality, the content, and the expertise that was shared in this book. So all our contributors, I can't thank you enough for bringing this book to fruition. So I'm going to talk about the Mayo Clinic patient-centered, innovation-driven projects around voice devices. And just a quick background on Mayo Clinic. 150 years ago, our Mayo brothers and colleagues funded this large integrated group practice nonprofit academic center with over 1.3 million patients seen annually at Mayo from over 150 countries. Mayo has invested in and made advances in 3 shields, and that includes our practice, education, and research, and even more importantly, around the use of voice-first applications and innovation across these 3 shields. So I'm just going to remind you that what we see, what voice technology can do, is revolutionize how we can personalize healthcare needs. And in the area of education, it's trusted health content that's most important to our consumers. And we used a motto: think big, start small, move fast. And in one area around education was our work with direct to the consumer, with over 8,000 answers to common health questions available today on Alexa-enabled devices and Google Assistant. We've been really, really excited about this work and being able to share Mayo's trusted health content with this volume of information around health to our consumers. I'm also going to talk a little bit about some practice efforts to increase the efficiency in the provider workflow area, and then some exciting work around research and leveraging voice signals and utterances to aid in clinical diagnosis. So some of the work many of you may have already seen or heard is around symptom triage and providing evidence-based knowledge at the right time to the right patient to meet their healthcare needs. And even more importantly, to provide this in a channel and device of choice that meets the needs of the patient. So the Mayo Clinic algorithms used what we call our nurse telephonic triage and embedded this into Sensely's avatar, which is a chat-based app, and we're delivering immediate care guidance based on user input. And these algorithms are relevant and provide current care guidelines. So it's exciting to see them being employed using this chat-based function. We also are using Mayo Clinic Live on mayoclinic.org to offer live chat support to help our patients seeking appointments at Mayo Clinic. What was really exciting was several years ago was work in our Center for Innovation looking at a dermatology pilot to provide post-procedure discharge instructions, and really wanted to understand the impact to the provider and patient reaction to receiving health information in this voice technology device, the provider desirability to continue to use this to make their work processes more efficient, and then the feasibility of voice technology in a clinical setting. And what we found was that both patients and the providers were very satisfied with this level of health information being provided in a clinical setting. More recently, we have employed what we're using is a smart speaker in an emergency room setting. Patients with chest pain who have obviously the most serious myocardial infarction are going to be managed appropriately. But when we are in a chest pain workup for an undifferentiated etiology, the goal was to employ the smart speaker in the emergency room, essentially in the exam room, to assist with providing patient education, general patient education, to assess patients' comfort with using the tool, and relevant health education when they needed it. And what's exciting is we're trying to see if this can improve the access of timely care, improve the efficiency of the healthcare team, and of course, the patient and staff satisfaction. So think about this: if a patient was to ask a question after they were told that you'll be getting some lab work to look at your troponin levels, and then you'll be going off to get a treadmill. Patients can use the speaker in the room, and the goal was to ask questions like, what are troponin levels? What is a treadmill stress test? And so this is another way to look and understand, can we improve the clinical workflow in the ER? I want to share this paper that we published on voice as a diagnostic tool in the research setting, but really helped us to understand if voice signals, utterances, frequency, and tone of patients who were undergoing a coronary angiogram. They looked at 138 patients, and they recorded their voice to capture their emotional state. And in this publication in the Mayo Clinic Proceedings in 2019, we were able to demonstrate that voice biomarkers could correlate with findings on the coronary angiogram depicting coronary disease, and potentially could help us as an additive tool to providing care at a distance. Very early work, exciting, and I think we're going to learn a lot more about using voice utterances as a diagnostic tool in other disease areas. And we talk about this in our book chapter that my team here at Mayo wrote as you look through this book. So I want to close with the voice experience from a clinician's perspective. I'm a healthcare provider, and we see patients, and we're always looking for creating value for the patient-provider interaction. And even more important is increasing the efficiency in a clinical setting. But the real issue around this is, how do you measure success? How do you measure value and efficiency in the clinical setting? We know there's a lot of concern around the clerical burden that physicians encounter every day when working with the EHR. So imagine, how can we use voice in this clinical setting, deploying those FAQs using the algorithm-based triage that I described, voice biomarkers as an effective diagnostic tool, even looking at voice and AI together to provide more of an individualized approach. This is how we're going to measure productivity and effectiveness as clinicians, so that we are able to spend more time with our patients in this physician-provider interaction. So what are some of the challenges that we're going to experience? And we know today, voice is more of a search and a command to a response that we ask of the speaker. Where we really want to be is a conversational interface. So technically, we want to really get to what we call contextual knowledge. Be able to really understand when the consumer asks a question where there may be a mistake, and resolve those issues. Even more importantly is behaviorally. How do you really engage with the voice-activated device to meet those personal needs of your patient? And then tactically, we really need to know, how are we going to embed and use these voice devices in the clinical setting, the workflow, and bridge that clinic to the home needs most efficiently, and again, impact the provider-patient experience. So looking ahead, we want to get away from the one-way linear engagement to what we describe as the omni-channel world, which includes voice. We're going to have drivers like big data, NLP, machine learning, cloud computing, AI. They're all going to help shape that provider-patient experience. But these interactions with the voice device have to really depend on trust with the healthcare content, the education. Not only trusted, accurate, but integral to that whole patient experience to meet the needs of our patients. So we're going to see many advances in this area, and we're excited that our book that all of you contributed to is really going to shape where voice technology is going to go in healthcare. The ultimate goal is to do what we really want to get to is individualized approach to the meeting the needs of our patients using trusted health content. So thank you, Teri. I hope I stayed on time or got you back on time, and I'm happy to take questions.
Amazing. Thanks, Sandhya. And as Dave said, like it's been a wonderful, wonderful experience doing this, and I'm just so proud of the project that we put together. But of course, the contributors put together with everything that they've done for the book.
Couldn't have done it without all of you too. That's the
that's
the
right.
thing. Yeah.
I agree. Absolutely.
I love having the clinical perspective from both of you, really. But thinking about those voice-based biomarkers and what the future might hold, just as you said at the end, for personalized medicine, and really taking that to a next level of how do we integrate that into the voice into the medical record, really. And that's really a nice kind of transition point.